just a couple of extra things that I wanted to mention that I forgot to say. If you do put your bemer on your bed, make sure that you put it under the mattress pad, the mat. And you just want to affix it so that the band where your pillow is so that it protects your head, and then the rest is on the obviously on the other part of the bed. So I didn't mention that. I've tried it, under a sheet or something. It just makes me too hot. So that's if you are just going to have it as a matter of course on your bed. Now, we haven't gone into the sleep program, but that would also be the case. So for the sleep program. And I just leave mine upstairs, it's on the sleep program. And then if you do use, or when you use the sleep program, which you're not allowed to use it until the 7th week, you still have to do your twice a day, 8 minutes. So that doesn't negate that, but it just takes your bemer to another level, and it really detoxes your organs, and it's great. The other thing that I wanted to mention was medications. My mother was on 4 different medications, and I've got a lot of clients that are on like tremendous amount of medications, like 13 or something amazing. So she went off all her medications in 30 days. She was 97. And the distributor that sold it to me and the doctor that we were working with, our family doctor of 40 years, nobody could believe it. She was on blood pressure medication for the last 30 years, losartan, within 30 days, and we were taking her blood pressure 3 times a day. It regulated at 120/80. Her migraine medication, she didn't need it anymore. Depression medication, didn't need it anymore, and nor did she use her dementia medication anymore. And her doctor said, let alone a 97-year-old, I don't know any of my patients that are not on medications. I mean, this was all a surprise. We weren't expecting it. This was not something that was a goal. I was just trying to get her to the point where I didn't have to put her in a nursing home, and I wasn't up all night and then working all day. So which was what happened to me. And then I went into adrenal failure. I wasn't adrenal fatigue, it was adrenal failure. I was under high stress, and I was just exhausted all the time. And the bemer rebooted my system. So I just want to mention, as far as medications are concerned, whether you're a distributor that you're working with tells you to do this or not, it's really a good thing to Google the name of the drug, even the amount of milligrams that it is, and just side effects of losartan, 25 milligrams, whatever it is. And just type it in, and it's going to spit it out, print them off, and put them on your refrigerator. I don't care if there's 13 medications, and then there's the husband and the wife. If you've got, 2 people that are on the bemer with lots of medications, it's good to post the side effects, because what's happening with bemer is that since it's opening up all these pathways and returning your blood flow back to an earlier age, many times you don't need as much medication to have the same effect as when your blood is incredibly stagnated and all these areas are completely closed up. So make sure you're working with your physician if you alter any of the doses. I mean, you can't just determine that on your own. And I had to keep going back and forth to the doctor. Now, I will actually admit to you that the first 30 days on bemer with my mother, I was in medication hell with her. And I kept saying to the gal that was working with me, I mean, she talked me off the ledge probably 5 times in the first 30 days. I was going, this device is not making my life any easier. This is making it harder. I mean, I had to keep packing her up, put her in the wheelchair, get her in the car, take her to the doctor, come back. I was working on people. I mean, and she kept saying, Kathleen, it's not the bemer, it's the medications. Kathleen, it's not the bemer, it's the medications. I mean, if she said that once, she said it 5,000 times. Kathleen, it's not the bemer, it's the medications. So I would go to the doctor and I would say, Dr. Davenport, you really just have to reduce the amount. I mean, she's hallucinating, you know, it's too much. And he's going, well, why all of a sudden is she hallucinating? And then I would explain the bemer and they'd all be on their devices trying to figure out what the bemer is. And I said, you're just gonna have to trust me. It's opening up pathways that have been closed for years. It's returning her blood flow to a much earlier age. She doesn't need the same amount. So they would reduce it, then they would keep reducing. And finally he said, you know, if you have to take her off, do. So that was what happened after 30 days. Now, obviously I'm not gonna take her off her blood pressure medication unless her blood pressure is staying at a really good rate, which it was. But her blood pressure was like so ridiculously high for years. That for it to regulate on its own was very surprising, and that quickly within a 30-day period, because there was nothing else we were doing differently. I mean, she wasn't exercising or anything like that. I mean, she could barely walk. So I'm just mentioning that with regard to medications. Some people don't change their medications at all when they're on bemer, and some people have dramatic shifts, like my mother. So I just want you to be aware that that could happen, and it's nice to know what your side effects are, especially if you're in a compromised system due to your age. If you have chronic illnesses and diseases like sugar issues and those kinds of things, you may just need to be a little bit more just cognizant of what's going on. Okay, that's all I wanted to say. Thanks.